please go ahead.
Namaste and good evening to everyone from New Delhi, India. I am Simi Mehta, CEO and Editorial Director of IMPRI, Impact and Policy Research Institute, and I welcome you on behalf of the Center for Habitat, Urban and Regional Studies at IMPRI, Impact and Policy Research Institute to this State of Cities conversation, hashtag City Conversations. And today we have gathered to witness a wonderful panel discussion on a people's war against COVID-19, unmasking the governing power in India, with Professor Xiangming Chen, who is Paul E. Raether, Distinguished Professor of Global Urban Studies and Sociology at the Center for Urban and Global Studies, Trinity College, United States. He's joining us from United States, and with Dr. Ziming Li, who is Assistant Professor, Lecturer at Wuhan University, China. She's joining us from China. And we have an excellent and eminent panel of discussants. Professor Jagan Shah, he is Senior Infrastructure Advisor at the Foreign Commonwealth and Development Office at the British High Commission in New Delhi. Dr. Shubhagato Dasgupta, he is Senior Fellow at Center for Policy Research, New Delhi. Professor Zufei Ren, she is Professor of Sociology and Global Urban Studies, Michigan State University. She's joining us from United States. And Professor Tathagata Chatterjee, he's Professor of Urban Planning and Governance at Xavier University, Bhubaneswar. The session will be moderated by Dr. Soumyadip Chattopadhyay, who is Associate Professor at Visva-Bharati University, Santiniketan, and he is a Senior Fellow at IMPRI, New Delhi. So I would now, I welcome all of you again, and I invite Dr. Soumyadip Chattopadhyay to take the session forward. So over to you.
Thank you. Thank you, Dr. Mehta, and good evening to all of you from Kolkata. Again, on behalf of the Center for Habitat, Urban and Regional Studies at IMPRI, I welcome you all to this City Conversation series. And just to give you a brief introduction to this City Conversation series, let me just add few points here. We all know that this COVID-19 is proving to be a pandemic capable of bringing the societies and economies to their knees. And the impacts of the diseases and the measures to control it have raised questions about epidemic preparedness. And there is an urgent need to examine how COVID-19 unfolded the way it did it, and to consider the possibilities for post-pandemic transformation. And COVID-19, again, we know that is large in urban phenomena, with various cities having become the epicenters of this pandemic. Although in India, we are seeing that COVID-19 spreads to rural areas and villages are ill-equipped to fight it. So nevertheless, some of the overarching questions are: what made the city so vulnerable? Why were they not better prepared? And what needs to change to mitigate the harm from their future threats? So these are some of the issues with which we are engaging with this in this City Conversation series, and we are fortunate to have some great scholars, urban experts, all over the from different countries who have already presented their thoughts, their opinion on these particular issues. And today we are honored to have with us Professor Xiangming Chen, who is the founding dean and director of the Center for Urban and Global Studies, Trinity College, and the Paul E. Raether Distinguished Professor of Global Urban Studies and Sociology, as well as a distinguished guest professor at Fudan University in Shanghai. He's a very well-known urban scholar, but still it is customary to give a brief introduction of today's two speakers, Professor Xiangming Chen and Dr. Ziming Li. And Professor Xiangming Chen has written and co-edited several books, to name some of the few, like the Belt and Road Initiative and the New Era of Regionalization, which is published by Routledge. Like Global Cities, Local Streets, Everyday Diversity from New York to Shanghai. It's also published by Routledge. And then The World of Cities, Places in Comparative and Historical Perspective, published by Blackwell. Confronting Urban Legacy, Rediscovering Hartford and New England's Forgotten Cities by Lexington Books. And several of his books have also been translated into Chinese, and his articles have appeared in almost all the major urban studies and international social science journal. And Dr. Ziming Li is presently the assistant professor at Wuhan University at Wuhan, and she is trained in economics and planning, works on the socioeconomic aspects of urban development, and her current research focuses on urban informality and unplanned urbanization in Southeast Asia. And as Dr. Mehta has already mentioned, that we are today joined by an eminent set of panelists, Professor Jagan Shah, Dr. Shubhagata Dasgupta, Professor Zufei Rain, and Professor Tathagata Chatterjee. So again, once again, on behalf of the IMPRI, I welcome you all in today's City Conversation series. And today, the topic is a people's war against COVID-19, unmasking the governing power in China with comparative implications. So may I now request Dr. Ziming Li to take over and present.
Thank you so much.
Yeah.
Okay, let me share the screen at first. Okay, and today we would like to present our recent paper, and it's about the urban governance and what is going on in China, especially in the past 1 year, and what is the comparative implications. Before I came back from Florida to Wuhan, I don't understand what's going on in Wuhan, but when I have a nearly 1 year living experience, and now I'm confident to tell you. So, okay. When I was in US, and I only read the news that about Americans' the perspective about China. And they said China's governance, especially in the pandemic period, is kind of a lack of transparency. And China's government get used to the use of a draconian approach to deal with these issues. But if consider their domestic failures of pandemic control, and they will consider that as China's fault. But what's really happened in China? How about China did something correct, but someone outside China, they don't understand the context. Even though the Chinese government issued the white paper about the experience and the lessons we learned from the fighting COVID-19 in China, but today I would like to provide more perspective and propose some questions to let us to discuss about many implications between China's experience and the Indians' current problems. So Wuhan, right now I'm in Wuhan, the first epicenter of COVID-19. You know, that's the capital city of Hubei province, that's in the middle reaches of the Yangtze River, the Mother River. And that's divided by 2 rivers into 3 parts. And you know that here we have a dense population, and even 12 to 13 times higher than New York. And because of the location here, it's an important node. And we have a lot of high-speed rail stations here that the lines just come and to the other directions. And this is the national central city. That means significance of economy and the politics and cultures here. So that means we have a high accessibility to other provinces, but that's a challenge of controlling population mobility and virus transmission. So Wuhan have early challenges in the first quarter last year. At first, there's some unknown cases, and we don't know how to treat it. And also, Wuhan has a shortage of bed facilities and medical staff. And we also have a limited capacity of private hospitals if you see the data comparing to the cases in New York or some European countries. And we also have a limited local health expenditure. And if you look at inside the city, we have an equal distribution of health resources across districts. So we have no choice. We need to sudden lockdown on January 23rd last year. But you think in a very big city that have 11 million people living here, And especially in the season of a festival, that's a festival, the biggest festival in China. And most of the people would like to go back to home. And there's a large migrations suddenly happened in the Spring Festival. How we can deal with that? If you just check the news, you may know that in order to mitigate the pandemic, and we suddenly built up 2 special hospitals, Leishanshan and Huashanshan hospitals. And that's decision-making just made very rapidly after the lockdown on January 23rd, that's January 25th. And we built up within 2 weeks by a state-owned construction cooperation. And everyone can supervise the construction progress online at any time. And the operation time is just from February to March. And we provide, that's hospitals provide 2,620 beds. And that's a free treatment for every COVID-19 patients. And you may also know that we have mobile cabin hospitals for suspected cases. And this provide a very good opportunities for the people around. And they also have a free treatment, and everything is free. And then we control that. Also, you can see the news about the support from the neighboring provinces. And we have a kind of a scheme like one province helped one district in Wuhan, and people in other provinces, if they are working in hospitals or if even they have some special techniques, and then they just arrive at epicenter in no time. So 6 days later, there's no COVID cases and the lockdown finally ended. And it's the next stage that we call Wuhan needs to revive after the pandemic. And if you see this curve, that we can divide the period into 5 stages, but this is not the ending story, but let's just look at the first and the second one. You can see that in the second stage that the central government, CPC Central Committee, that they set up a central leading group, and then close off community management started also in this stage. And you can see a sharp reduction. And then in the last 2 stages, and finally we have 0 cases. And in the 5th stage, we are also here that we still keep continuous prevention strategies. But you may not know that what is the resilience of China's governance in responding to a major crisis? For example, how do various local and extra local stakeholders respond to an unprecedented public health crisis such as COVID-19? How did the governing parties in the Chinese system adjust the responses to the dynamics of the crisis? How has the pandemic mitigation recognized the existing community governance and collective actions? If the previous scholars, they have done this relevant work, then we can build up our argument on it, like agile and adaptive governance and crisis, that they said real events test the resilience of governance structure, and governments and organizations learn from converging and conflict license. But there's a missing point. So how about the centralization or decentralization process? What is the impact of this factor? So we argue that because of the progress urban governance, and it's very challenging for local governments like Wuhan that already put so many effort to the investment or the infrastructure construction for economic, then just meet the early challenges from other aspects. For example, we already have a shortage of health facilities, but they don't have enough public investment on it, and how they can deal with that. Also, we argue 2 types of centralization that play an important role in mitigation. The first is a vertical centralization, but the previous scholars that they argue China's governance is like a fragmented authoritarianism. That means the departments of the government and the sectors of the department, that they have some overlapped functions, but that's just increase the inefficiencies of the governance, and it cannot mitigate the emergent situations. So the governance restructuring between central and local governments, we need to look at this aspect. And also a developmental state during the crisis, his argument didn't address this point. And the second centralization is horizontal one. And the previous scholars argue that China's grassroots organization is a kind of a mechanical. It is not real and voluntary participation, or like in democratic societies that people have this civil participation. But if we look at it in another way, the relationship between state and the society, there is an integration between state and the society just happened during this urgent situation. And we also look at the role of civic factors and the social forces. And there's an innovation of grassroots governance in China. That's it's called great governance. And after 2016 around, and we have a lot of organizations that they show their power, and then the government consider how to involve the civic factors and let the combination of grassroots governments and the grassroots organizations contribute to the society. I will talk about it later. And the last one is the support from the people due to mobilization, the culture of collectivism that's especially you can observe in East Asia, and also the learned experience, because this is a long time pandemic period, and people get used to the different situation, and they need to understand what is the uncertainties here. About a power reskilling. There is a decisive national strategy, and this is very unique in China because we suddenly established an anti-COVID-19 pandemic central working group on January 25th. It's a kind of a decisive step. And the centralizing patients and assembling experts and resources for collective treatment that reflect a clear top-down strategy. And then the early test, early report, early diagnose, and early quarantine principles from the beginning to the end. That includes massive resources from central to local budgets, and medical teams, medical workers dispatched for support, and special hospitals within 2 weeks, and participation of state-owned companies. This chart shows the government structures, especially their actions and how they collect the information from the grassroots to the top. You can see the important role of central working or steering group that they represent the state council, the CPC central committee, and they can just go into different levels of local governments. They can even go to the neighborhoods and hearing from the people. And then the other important aspect is how we collect the information about cases. That's the joint effort from the community grid, Shah office, and then they go direct to city level, and also the public hospital. They collect the information of cases, the patients, their needs, and then they report to higher levels of the government. And because this government structures two parts, one is political leadership and another is professional leadership. So CPC lead the political leadership, and the political leader of the same levels, they supervise the professional levels horizontally. And how about the society? Actually, there is a kind of mixture or semi-connections between society and the states at a different level. We can see that from the beginning that the social media that report some news about a patient in Wuhan, and then these informations go to the central government. Then they dispatch the steering group to investigate what's going on there. And also when in the different stages that the local government have something improper, and then the social medias they report, and the public media also engage in, and then they get the attention of the central government. And the presidential order state notice announcement is a kind of a formal way to push the actions into deep and into practice. For example, testing, lockdown at the city level, and they build up the hospitals under the support of different people and organizations. And then at the individual levels, people or residents, they are organized by the residents or committees, property management companies and grid workers. They do a lot of work. They help people and they inform people. Also, they supervise people like scan the QR code when they enter into the gated community. And they need to check the temperatures of the people if they go to the public space, the entrance of the public spaces. Mask wearing is voluntary, but at the beginning, this a kind of rule that needs the committee, residence committee, and also the organization like schools, companies, and their working units, NGOs, to give them education and persuade them to wearing face masks. Social distancing is also important in the public spaces, and people have a kind of self-policing. And right now, we already get the learned experience, even though there is no warning or there's no outsiders punishment or something, but still people have the experience, or they just have this habit. So we have a very cooperative grassroots community, and we executed it efficiently. That's maybe based on the collectivism, part of it from our traditional culture, Confucianism, that we think the collective interest sometimes need to before the individuals, especially in this urgent situation. And then we also have a communism culture, and also we combine them together. Then it's easier for people to draw the consensus. This consensus, you can see it is at the level of the state. It also at the level of individuals, because we love our community, like our gated community. We know each other. We don't want to affect our parents and friends in our community. So that's why we have a very strict self-policing to wearing face masks. And this one, 社区 office and the community grid, the innovation grassroots governance is also important. Before this crisis, this usually just to collect the information of households, like how many people in your family, how about their registrations of some social welfare, and what is the condition of their housing. I once was the volunteer for my community, and I know that people do a lot of work. Sometimes they need to issue the notice from the municipal government, like how to clean the community, how to collect the trash of, or how to do some certificate things. And they also help the elder people, especially during this crisis. And then they play a very important role to transfer the information from the top to the bottom. And also they collect the information of each family, how many people get a disease, have some fever, even though they don't get a chance to diagnose in the early stage, then they report the situation to the upper level. Then even though we have a limited resources, and still the people's information are registered, then they have a chance to get into the public hospital in line. And even after this community grade or the CHURS office, they do a lot of work for the people. And I will show you some photos later, like this. This photo is a lot of words that describe how we can do some mitigation or preventions in winter last year until this spring, because at that time we don't have a local cases, but we still think prevention is very important. So that means every resident need to wear the face mask if you come from outside Wuhan, and especially from the high risky areas, then people need to report to the CHURS office. And if you enter into the entrance, like this a photo showed, you need to scan the QR code and they check your body temperature. Because of this work, they just really like the hands, so they have to close the entrance. So you can see that in many public spaces or even the shops, stores, colleges, and then they have to close some entrance and just leave one, and controls mobility of people and let them to get registered, digitalize the people's travel report even within the city. This is the in the middle, this is the QR code. The green one shows you are healthy, no problem, enter. The yellow one means some people come from the high or medium risky areas in a quarantine time, but within the 7 days. And the red one is that within the 14 days, the quarantine. So the red one, if you have that code, you need to stay at home. It's not wise to go outside. As for the reinforced prevention, we can see from these two charts, because the new Spring Festival come in 2021, and people still worried about, can we go back home just like last year? But maybe we will have another pandemic crisis. So what should we do? And in the beginning, government just think it's okay. But then they said, okay, we should consider how to have some like stay-in-put vocation, but it's not like as strict as the previous one that suddenly locked down. It needs to have some flexibility here. So the government encouraged the companies to consider some ideas like provide the bonus or the actual salaries to their employees, or some other non-monetary support for especially for the migrant workers if they don't want to go back to hometown during this Spring Festival. Also, the mobilizations that we can see every day in the TV and even mobilized by friends, because we think family and country are integrated together. In Chinese, family and country, they are the one word. So if we love our family, then we need to do something. We need to protect our old parents. They are vulnerable. Then we should not just go back home like before. This is the big issues that behind of our choices. And voluntary choices due to the fear of uncertainties and members of quarantine. So someone, especially people in Wuhan, they think, if we go back to home outside Wuhan, then maybe next time we cannot go back to the working place. So it's better to stay here. And that's the kind of thing that people already learned from their experience. You can see that the effect is very significant. Comparing the travel data 2 years ago, and we can see that in 2021, that reduction is very significant. And you can also see that even though before the Spring Festival, we have some new cases reported, but after Spring Festival, the cases just reduced sharply and even nearly go to zero. So that means this stay-in-put vacation, maybe initiatives or people's choices, collective choices that really work. Reflections on community governance. So the convergence between the national response and the community actions. So that's one is digitalize the bottom-up and top-down transfer of information and opinion, and interactions between grassroots and the governments through social media. Sometimes the grassroots report the corruptions, or they think the one-size-fits-all cannot work in their own communities. There is some formalism, and then the government at the top levels, they know that, then they issue the new notice to correct the local governments. The second is grassroots cooperation matters greatly. That includes adaptive individual behaviors to collective interest. Maybe that is the Asian culture. I'm not sure if we can find in other countries, maybe we can. And for example, the entire city nuclear acid testing, lockdown, vaccination that people supported. For example, in some other city like Shijiazhuang in January 2021, and really in April 2021, we have new cases, local cases reported. And the cities level, they have a rapid mitigation actions, and they just copy the experience and the lesson from Wuhan, and more easily to be cooperative due to previous mobilization. Yes, that is, they also, both governments and the individuals, the societies learned how to deal with the similar cases. The third one is mitigating structural vulnerability. It's kind of controversial because whole nation or whole city system sometimes cannot meet everyone's problems or needs, requirements, especially if we put this experience into a global cases. Maybe India have a more diversity than China. So maybe it's a kind of challenging for Indian to learn directly from this system. And the second is overuse of power at the grassroots level. Yes, we need to consider of this further. And the third is mobilization versus self-motivated civil participation. But that's strengthened faith in state authorities and then push the consensus. The post-pandemic governance in 2020 summer until present is, I do a concluding remark, is we have the habit of masking and precocious behaviors and rules. You see the two photos, people use the toothpick to press the button in the elevators because that's avoid the contact. And the sculptures that wearing the mask show this is already the culture. Wearing mask is a culture of Wuhan. And the digitalized the record of personal health scan code, and it's also the habit for the individuals, also the habit of the local governance. The third one is very important. That's reinforce the public health system. And the Wuhan governance and the Hubei governance got many support from other parts like the state, even some other donations. Then we have money. Then we want to solve the problem from the origin, equalizing the health facility in Hubei. And we have a lot of new projects. The second is build up a national medical center for major public health events in Wuhan. That's the third one in China. And then promote the Center for Disease Control and Prevention into National Bureau of Disease Control and Prevention. That is the action of the states. That's show how the state government put this crisis as a big license, and we want to learn from the license by have the system reform. And then we have a continuous community participation of party members and volunteers. As I said, the great governance, 社区 office, they really lack the hands. So that need people from other department, from other working units. For example, I was the volunteer and then I just go to work for them and without any money, but I would like to help my people, my community, to help them to collect the information of the households and then correct some information that they did something wrong. There is a continuous control on new cases within an alert and a mature system. Digitalize the travel record and report personal travel report to working units or 社区. So my university, they have such kind of system. They ask the teachers to record their students' travel record, especially if the students travel from some high risk area. You can see the third photo. So the white papers, actually, it's the list that's put the neighborhood's name, which have some cases, new cases, or some places already labeled as a media risky areas. So the people know which type of people need to report to the digitalized system. Also, the international travel control and supervision and quarantine continued. I have a lot to see, but time limits I can share with you later. And the faster test for whole cities and active participation in vaccination. Also, about the vaccination, there's some doubts in the beginning. And there also have some problem of shortage. But when current the situation move on and we have enough things to do for the people by working units and the neighborhood, they just organized by this two type of units, so people get information when and how to get a vaccination. Also, after the lockdown, we have economic recovery strategies, and the central government gave a lot of beneficial policies to Wuhan and Hubei, like like a tax reduction. And also Wuhan and Hubei have our own strategies, like give the consumption bonus. And the local government also changed their mind towards the informal economy before this economic recovery happened. And even before this crisis, the street vendors and food stores in many places is forbidden. But in a short period of time, that's tolerable. And national TV also have a space for the products from Wuhan and Hubei. So that's encourage a lot of consumption and tourism consumption here. The conclusion is there are two types of centralization converge efficiently and effectively. And we have strong state, centralized and top-down measures, and society and community represented with full and willing cooperation. Not only goes along with an authoritarian regime, but also features learning and self-correction according to local situation in post-pandemic prevention. And the last but not least is this people's war and its global implication. People's war doesn't mean war against, doesn't mean people, one group of people against another group of people. That not mean the real meaning of the people's war. The enemy of the war is virus and uncertainties. So people's war means unite, we win, and we are all people, we are all human beings. When now we united together and to win the war against the virus and uncertainties. And there's some implication I recently got. The philosophy of China's mitigation and urban governance can find from an old saying from Chairman Mao. He said, a single spark can start a big fire. But if we just control the fire in the first graph with water, then there's no way that can develop as a big fire. And preventing from the very start is the best mitigation. That's active. But how about India? India at present, the situation like welfare everywhere, and the regime and the capacity of the local governance is quite different from China. So how Indians draw lesson from China? Maybe we need to look at it in another way, more proactive way. We need to mitigate it from other aspects. Having better preparation from many other aspects is even better. How? Recently, we have a forum about the high quality development of the metropolitan areas in the middle reaches of the Yangtze River in Wuhan just a couple of days ago. So what is the purpose of the high quality development? So that is mean people-centered, give people better life. What is better life? At least first, primary is the safe and security. So the public health is it's a pivotal thing to consider. And then we need to develop. If you give people the jobs and equalize the infrastructures and many underdeveloped areas within this country, like small cities and towns, and people don't need to travel long distance and they can work at their hometown. Industrializations, they got economic opportunities, and also the small cities, they get a better health infrastructure, better education opportunities. Then they will avoid the problems happening in India right now. And we have a plan. It's not just happen in one city. It should depend on a bigger picture of urban and regional planning. So what is the urban and regional planning currently happening in China, and why the central China is very important? If we see this graphs in another side, the right side, it's about the middle reaches of Yangtze River region and urban agglomeration. In these central areas, Hunan, Hubei, and Jiangxi province, we have a lot of underdeveloped areas, villages, rural areas, small towns, and they have a lot of poverty issues. And if they got a crisis, the pandemic crisis again, and they have no chance to go to the big hospital. If we give them more opportunities to equalize the infrastructure investment, to make some industrial transfer to these areas, and then the cities developed well, and people will avoid the opportunities of the pandemic crisis. I mean, the bad effect of that. And if you see the regional plan in the 14th five-year plan of development, we have 19 metropolitan areas. And if you see this slides in his presentation, and we not only consider one city, but also mega cities. And we connected those metropolitan areas by the good infrastructures of transportation. And then the whole China, the whole urban areas of China, as well as the rural areas, they connected together economically. And this is our strategy. So we're not just focus on preventing the crisis, the public health crisis, but also we want to develop our cities in a different way, not just focus on the GDP growth, but also focus on the high quality of the development. So this, my part is done, and Professor Chen will give more explanations about how we can do a comparative analysis and what is the further comparative implications. Thank you.
Well, thank you, Ziming. First of all, I'd like to thank our gracious hosts at IMPRI for giving us this opportunity. I think we're almost out of time for our portion, so I'm going to be very, very brief. I don't know whether I can control the slide or Ziming, maybe you can flip through the data part.
Yeah.
Yeah. The next slide, please.
Okay.
Yeah, I just want to make a brief reference to this paper that I wrote with an Italian-Chinese student last year that we published. So we did a comparison between Wuhan, the China's epicenter, and Milan and the Lombardy region, which was Italy's epicenter earlier on. Next, please. So maybe you can skip the data part. I want to get to the conclusion. Yeah. Okay, next one. Yeah, next one. Or we can skip this part. Yeah, this is talking about data issues. Okay, all right, here we go. I think for us today, comparing China, India is difficult, right? So you have a highly centralized versus more federal-like system. But I think, this paper we did, brought Italy is an alternative reference point because it is also a country with lots of regional autonomy. Some call it a country of regions. So what we did, we found out was that there's a lot of variation in how regions in Italy responded to the pandemic. Lombardy, where Milan is the capital city, is Italy's most wealthy region, right? It has lots of good medical infrastructure, lots of economic resources, but did not respond to the pandemic very well earlier on. And on one hand, it deferred to Rome, the central government. On the other hand, did not handle the relationship with civil society. A region where it has lots of rich social capital, lots of strong civic engagement. But the other point I think Ziming made very clearly is that cities cannot beat the virus by themselves, right? So the medical infrastructure has to work very well under the extreme stress. And I think even though Lombardy had the world's best medical care system, one of the best, and it suffered under the initial patient rush to the hospital, and the national government responded in a timid way, right? Tried to bring back, retired doctors, graduating nurses earlier. But Wuhan did it the way that Ziming discussed, right? A lot of support from everywhere, matching support and a resource transfer and so on and so forth, right? But also there's a lot that we can talk about, private versus public hospitals and how that sorted out, I think, to Wuhan's favor in terms of suppressing the virus and kept it down. But I think the last point I think is really important. I think, we call it a convergence between top down, bottom up. But I think it takes a lots of conforming and trustful and satisfied community individual level responses. Next slide, please. Next one.
Yes, I just
we can go through, skip this. Yeah.
Yeah.
And I just want to, I think we skip this one. Yeah. It's not moving.
How about?
Yeah, we can, one brief comment on this one, right? This was an interesting thesis by a student at Trinity, a senior who just graduated. And he did a comparative study of 4 regions in Italy and found out, the difference between North and South, right? So looking from the sociological, social capital perspective, the regional deposit of that varies. But what he found was that the northern regions like Veneto, right, next door to Lombardy, did a lot better because the government broke out a kind of a tacit acceptance of using the community's strength, social capital to respond. But in the South, there was also variation between 2 different regions. So, and I think on the Chinese side, we'll say, the equivalent to social capital, or we call social networks, in this case, already embedded, right, in the collective community norms. So it has a favorable, conducive responses to a top-down national response, under a grave crisis situation. So it takes both the top-down, bottom-up conversions in order for the implementation policies to be truly effective. Next one, please. Yeah, we can skip this, talking about total versus proportional responses. This is a very important point. And next slide. Yeah, you can click again. What we see here is the importance of border control, right? So we see India and Nepal, right? Share a long border, 1,700 kilometers. But again, we see a strong correlation, very easy to cross border. I think more recently, Nepal obviously imposed control on only using 13 of the 35 border crossing points. But if you look at China, next slide, please. Okay, you know, between northeastern India and Myanmar, so we can see the border spillovers, right? Migrants returning from India back to Myanmar because of the rising infection cases. So the border is porous, is very open, loosely regulated, so that it has this potential to spread the virus very quickly. Next one, please. And again, just a data about you know, trust. You know, this is one of the rare surveys done by the Harvard Kennedy School on social satisfaction, trust of government. What you see here is a very hierarchical level of satisfaction, right? The central government has the highest level and increasing over time. And so this is very interesting. It's the reverse of what we generally see in the US and Western democracies, where the mayors and the governors get a higher level of trust, right? And they're the people close to the problems. They're the so-called getting things done, right? GTDs. But here you see, again, the advantage of a higher level trust from the central government and pushing down, you know, the control measures through the lower tiers of government, which has also experienced a higher level of acceptance and satisfaction over time, particularly actually under Xi Jinping. The next one, please. I think the last one, next one. Okay, uneven recovery, it's been talked about it. You know, this is my final sort of point, right? So what's gonna happen in the post-pandemic world? So China, in many ways, has become a kind of a reference point. In any of these forecast scenario projections that China is used to talk about the level of control of the virus, but also the degree to which China's economic recovery will impact other countries, the global south, even the global north. Next one, please. Yeah, again, you know, the UN is projecting a considerable decline in foreign direct investment globally. So I think China may be, you know, stepping into this vacuum, right? Covering this deficit in global investment through what? I think the Belt and Road Initiative looms very large. In this case, the next one, please. You know, this is a chart that I drew from one of my earlier papers talking about, you know, the domestic international connection, you know, between cities and regions inside China and the neighboring countries, including South Asia. You know, here, obviously, India-Pakistan conflict and tension is very relevant here. And then, of course, you're looking further west, connection, China-Europe freight train, and also China's involvement in Africa. So I think this is the point I hope, you know, maybe we can look forward to in discussing, you know, what does this mean, you know, in terms of what China has done domestically and the implications globally. Thank you. I think I'll stop here and turn it over back to you. Okay,
Thank
this
you.
one is worth looking at. Yeah.
Yep. And then we have open discussions. We have the question to the audience.
So, well, thank you, Professor Chen and Dr. Li, for your interesting presentation. And what I see is that this entire success story of Wuhan is basically the well-orchestrated coordination strategy among the different levels of government and the governance actors who draw their strength from the political and societal structure of China. You talked about the effectiveness of the phase strategy for returning to the normal phase. Also, you talked about the cooperative, the grassroots community, well supported by the traditional culture. For example, you mentioned about the role of the community volunteers who actually played an important role. This is an example that in the dissemination of all the information, and also the importance of a committed and effective local and grassroots leadership. And also Professor Chen mentioned about the importance of convergence between this top-down containment and the bottom-up cooperation, as well as the trust between the government and society, which works in favor of this effective containment strategy. So once again, thank you. So without further any comment, let me just go straight to our discussion today. Let me first request our panelist, Professor Jagan Shah, who is the Senior Infrastructure Advisor, Foreign and Commonwealth Development Office, British High Commission, and the former director of one of the premier research institute on urban studies in India, the National Institute of Urban Affairs, New Delhi, to please share your comments.
Thank you, Dr. Chattopadhyay, and thank you very much to Dr. Ziming and Professor Chen for the presentation. It's extremely thought-provoking, of course, and I think the data has been analyzed in such a way that we can actually draw the insight that we require. I think the comparisons between the Indian situation and the Chinese situation are probably not going to teach us very much, apart from the fact that there are some fundamentals which seem to have worked in the Chinese context, which seem to be missing in the Indian context. And probably the one point which came across in a very, came across very loudly in my understanding was the reference to the collective behavior in the Chinese context. The sort of harmonization of Confucianism with a sort of communism culture has created the appreciation for the collective as being first and foremost above the individual. Now, there are many debates that can be done on this basic point, but what I'd like to say is that on that very basic point, we have a fundamental difference between the two societies and two countries. We have a lot more inequality and division between society within India. And it is at a time like this, during the pandemic, that these divisions become extremely stark and visible. So, I would stop the comparison right there. Fundamentally, that begins to have a cascading effect on every aspect, how the state responds, as well as how society is able to cope. I wanted to just pull out some salient points which I thought were really worth learning from. One is that there is obviously a level of standardization of the system in the context of Wuhan and China, which really comes into play at a time like this. When I say standardization, it basically means that essentially the community grid that was mentioned by Dr. Ziming, that community grid is almost ubiquitous and standardized in the sense that you can go to a health facility anywhere and you are likely to find the same kind of facility or the same kind of response. So that standardization across the system is fundamental. In our context in India, we tended to have a huge variation across the system itself. And it's a good lesson for us to understand as we build greater resilience into the health system in India, that standardization is fundamental. You should be able to walk into any facility and find the same level of service. That's very crucial. And I'm sure that China must have had some variations as well, but during the pandemic, they seem to have kind of tightened the system to a point where they could make it that efficient. The second, of course, is, and those who know my work know that I work a lot on digital governance and digital evidence-based decision making. Clearly, this is the case where the use of digital technology has supplemented, has supported, and strengthened the innate capacity of the society to cope with a disaster situation. And that is an important distinction to make. We are not seeing an evidence where digital technology has either dictated or led, it has served the people. So this is fundamental. There is a lot of distrust in the Indian context of digital technology because there is a belief that it starts dictating how people should behave. And in some cases that happens too. But fundamentally, this technology is something which works as an instrument to actually help society cope. And I think that was fascinating, and the way in which the sort of geolocation and the contact tracing based geolocation of the spread of disease, the way gated communities are using QR codes, this is the level at which you can see the efficiency of the system actually working. So something to learn from that. How the community grids and the grid governance actually works with digital technology and becomes stronger. Another takeaway for me, and especially in Professor Chen's comparative study between Italy and the Chinese context, is that, and this is reflected in Dr. Ziming's presentation as well, that one shouldn't rejoice too quickly. There isn't a quick end to a pandemic. A pandemic has a very, very, very long sort of tail, and so it's very important to recognize that long-term management of a pandemic, the way in which China seems to have reached a level where, for instance, Dr. Ziming talked about the wearing of masks, the use of toothpicks when you're using a lift, uh, habit formation. This is essentially habit formation. So a pandemic isn't over till society has formed the habits which are necessary to prevent the next pandemic. So that's a key learning that we get from this experience, and it's a very valuable insight. There's just one other point I'll mention, and I'll stop there. Is this distinction between different kinds of governance structures? Dr. Ziming talked about various ways to understand the Chinese situation, whether it is fragmented authoritarianism or horizontal centralization and so on. But in this, I think this is a question that India will have to ask itself. We seem to be still grappling with the distinction between what is the role and the actions necessary from central government or provincial government or from city governments. This overall governance framework is fundamental. I think it's something that needs to be debated at a national level, and especially in the case of managing the pandemic, we seem to have kind of stumbled upon a major weakness in our overall structures, where it is not enough for you to stipulate, whether in the Constitution of India or you stipulate in government protocols. Fundamentally, the system has to be one that starts from the ground up. It has to understand that when a situation arises on ground in any part of India, what should be the right hierarchical or horizontal integration that needs to take place. So in a sense, we have to learn from this pandemic to design our governance architecture in such a way that it is fit for purpose rather than, in a sense, dictated by either legacy or some kind of statecraft logic, which belongs to a very different era. I'd like to just stop there. Thank you very much.
Thank you, Professor Shah. You rightly mentioned that Indian case clearly demonstrates the need to provide some local contextualization of for the global public health advice and the pandemic responses, depending on the India's socio-political specificities. Next, I request
Dr. Chattopadhyay. So, yes. Sorry, can I just correct? I wanted to just correct that point there. I'm not talking about contextualization. You see, this is the language in which we speak about localization. It is from the ground up. It is not contextualizing something which is top down, but it is actually deriving its logic from the ground up.
Okay.
So just wanted to clarify that. Thank you.
Yeah, thank you. Thank you for this clarification. And let me now a request Dr. Shubhagata Dasgupta, who is the director of the Scaling City Institution for India, Sanitation Initiative at the Center for Policy Research, New Delhi, to share your views.
Thank you very much, Mr. Dr. Chattopadhyay. Thank you, Dr. Li, Professor Chen, for that insightful presentation. It was very good to hear a story on these lines. We of course do hear about it, read about it a bit, but it was refreshing to hear it from the ground, so to say. It means there are a number of points of query that I would love to discuss for a significant amount of time with you all. Prima facie, the main concerns that I would like to frame my set of queries on, and for some sort of response from your end, would be around what do you see. Means you do see that there are different power structures in the way governance is arranged, especially for cities, through the various tiers of government, as well as how much the government or the governance system itself encourages society to get together, to work together, etc. Right. So in both the formal and governance system, but also through more tacit, informal methods. Right? That, in contrast to societies and governance structures which are absolutely individualistic, means are pursuing paths towards individual solutions, and looking at in a sense of a different level of a set of rights that seem to be passed on as universal and applicable, should be applicable to all. Within this context, let me start by the India case, not in a sense of comparison, but in the sense of positioning it, is that it means the lessons that we are learning from the pandemic are surely about moving up a system of order to a level of order that better recognizes all these challenges and articulates them more formally. In the past, coming from our past historic governance structures, which have not seen a major collapse or a crisis in the past, the transition through to our independence was not very structurally destructive, or change did not bring in that much change. So within this growing regime, we do see that this is a major inflection point for us to reconsider how these power structures play out. My question more would be to you all to kind of explain whether you see this as an inflection point at all in the Chinese governance system going forward, or would you say that it was so well prepared in the past that it will not, this will not be a crisis that will change it significantly going forward? Your opinion on that, and means why would you say that is going to be something that I look forward to hearing from you about. I did see a lot of that. Means the explanation, Dr. Li, about how the collective seems to work. So what I didn't see as much, or I didn't understand as much, was whether this collective has the same nature evenly across all of China, across all cities, across all regions, or not. And if this collective is so even, means is it, how embedded is it in the political culture too, right? Or whether I mean, so is the power structure determining the collective, or is it some cultural norm that is determining the collective? And if it is the cultural norm, it's hard to imagine that there will be one society across such a big space. So I'll just leave it to these two main points. If you could address this when you come back in. Thanks so much. Thanks.
Thank you, Dr. Dasgupta, for raising these important questions. So these are all questions. So let me now request Professor Zhu Rain, who is the Professor of Sociology and Global Urban Studies at Michigan State University, to share her views.
Okay, great. Well, thank you, Ziming, for such a detailed report from Wuhan. I think it's especially very informative for those of us who can't go back to China because of the border control. So now, at least for me, I have a much better understanding of what has been going on in Wuhan and the Hubei province. I have a lot of thoughts about the two papers, also the second one on the comparison, but I'm just going to focus on probably 3 points. So this first point is subnational variations. So as the previous panelist commented, China, also India are big countries. So if the central government says something, then the implementation can be very different across cities and communities. And one good example is Shanghai. So Shanghai has taken a much nimbler approach from Wuhan and other hardcore cities in the north part of the country. So maybe you can comment a little bit on the subnational variations in the pandemic responses. And the second one, I really don't know much about this, and I want to hear what you think about this. The second point is the relationship between the government and scientists in China. We see some very contradicting examples. So there are scientists like Li Wenliang, who's a tragic case. He wanted to speak truth, but was silenced and then died. But we also have doctors such as Zhou Nanshan, a very well respected figure by almost everybody in the country. And he has a close relationship with the government. And then we have public intellectuals, experts like Zhang Wenhong, who's the chief of the COVID task force in Shanghai. So he's become like a celebrity, hugely popular. So there are these very different types of scientists, doctors, and they have their relationships with the government are quite different. So I wonder what's your take on this, how the government, the central government has used the expertise from doctors and scientists to strengthen their pandemic response. The third point is the relationship between the government and the people. So this is a mega point. So the great governance system has worked very well, but it's not a true grassroots initiative. It's jump-started by the government itself. So I wonder if there are some ethnographic studies on, for example, grid managers in Wuhan. And if how much we know about what these people, grid managers, really think about their work. Of course, I don't doubt there are volunteers who really believe in the system and they spend a lot of work trying to help their communities. But I've also read media reports about the unwilling volunteers. They are not paid and it's just a lot of pressure, and sometimes they are reluctant to do what they are told to. And the final point is, this is probably for everybody on the panel. So at the beginning, Soumyadip raised a question about what's specific, what's unique about cities, what makes cities vulnerable in times of the pandemic. And I guess my question is similar, but from the other side, what makes our cities resilient in times of the pandemic? So if we compare cities with suburbs, with small towns, or with the rural areas, if we focus on cities, what are some of the lessons we can draw about for building more resilient societies? Thank you.
Thank you, Professor Brain. Surely we would hear the responses of both our speakers to all your queries. And now let me request Professor Tathagata Chatterjee, who is the Professor of Urban Planning and Governance at Xavier University, Bhubaneswar. If you so please share your comments.
Thank you, Dr. Chattopadhyay, and it's really a wonderful listening to Dr. Li and Professor Chen. So it's a very nice learning experience. I think there are two very important takeaway points here. One, the Chinese management of the pandemic shows, it is a pandemic has become like, I would say it is a collective action problem in the area of multi-level governance, because on the one hand, the cities has become the epicenters of the pandemic. But in India and in many other countries, we see that with the migration of people from the cities to other parts, with the flows of people, the pandemic has spread. So it has got two dimensions. On the one hand, it has got a spatial dimension, where the big cities were initially at least the main epicenters. At the same time, there is a flows dimension, which is linked to the movement of people. So to manage both the spaces and the flows dimension, you require a very strong multi-level governance framework. So the city governments, as Dr. Li has initially talked about, lacks the basic infrastructure, finances, capacities. So then the issue comes at how the governance can be augmented at a short span of time. And there, the state capacity question comes into play, where we can see that in case of China, that massive mobilization has happened on the level of a centralized state authority at the level of the national government, to have augmented infrastructure at local levels. At the same time, there is an issue of, the embeddedness of the state in the society, where we see this point, what Dr. Professor Chen has mentioned, is that how the communities rose up to the situation. This point was made by Dr. Jagan Shah as well. There is a cultural dynamics here. It's about the Confucianism and communism, its interface. But I have got a different question. And I take my cue to some extent from what Professor Ren was asking. I would like to ask, how this connection between the city and the community were operationalized. What were the organizational structures which made it possible to have this grid governance system work at a very short span of time. I mean, technology no doubt played a very important role, but technology is at the end of the day, it's a tool. So what were the human factors, how it played out? I mean, if there can be some discussions on this, it would be great.
Okay, thank you. Thank you, Professor Chatterjee, for your questions. And I think it's over to Dr. Li and Professor Shen to respond to all the questions and comments raised by our discussion. So it's over.
Soumyadip sir, would you also like to give some of the question?
Not now. If time
I
permits,
just wanted to add that, Ziming, why don't you also tell us that what was the role of the hukou system in all this? Just a student kind of question. Okay, please go ahead.
Wow, a lot of big questions. And wow, that if I answer one of the questions, then this is a new paper published. For example, the question about the relationship between the power structure and the collectivism, who influence which one influence which one. And wow, that's hard to say because under the different contexts, and then that's a different way to define the collectivism, because collectivism is a kind of a principle. But if you see people's actions or the policymakers' choices, priorities, then that's they have a different constraint. For example, if just in the context of choose how to choose whether stay in the working place or go back to home, if you consider this is only outcome of collectivism, and there is no power structures here. But if you think maybe in other contexts that changed, the collectivism, like we consider wearing mask is the way to protect the collective interest. Then we put collective interest before individual interest, like my self-confidence, no, convenience or comfortable feelings. Then this collectivism, I think it's most based on the experience. But also you cannot see there's no influence of mobilization. And then the mobilization most happened in some centralized society. So it's very hard to tell how much this factors, culture or political factor that influence people's behavior. But if you think about a power structure or some governance principles in China, there is a kind of a competition among the local governments, and there is a centralized or decentralized double system. If you use the case of physical decentralization and the competitions between the local governments, because they have the strong incentives to have promoted by the higher level governments. But if you consider in this complex situation, then the collectivism sometimes is a combination of culture and also the I think it's the administrative system and also the political system. So it's very hard to tell. As for Professor Jin's question, so about the relationship of between the grassroots level organization and the individuals, and what is the real situation of grid managers, I think this is a really controversial things, because this is a kind of semi-informal organizations. So sometimes the management of the grid manager is not like official officials in government. So they have a low paid job, and this is a temporary position for them. So yes, that's sometimes they don't want to do a good job. And some volunteers, they also are required by their working units or organization. I mean, the working organization, not the grassroots civic organization, to make some contribution to their community. So this is a kind of a thing that happened in China. But you think this everything have a context. If in a crisis a context, then the people think what they do is what the society needs. Then they have some social factors behind their action, not just the administrative factors or some political factors. Then they may change their minds to do more job. But that happened just in a particular context during this pandemic crisis. I'm not sure in the daily situation, they still have this kind of enthusiasm. Yes, I think the other question is a lot. And I think Professor Chen will have a lot to say.
Well, I would just add, maybe a couple of elaborations, confirmations to Ziming, and I really appreciate this range of questions and comments. I think they all very thought-provoking. I think on the subnational variation or the degree of standardized power implementation across a very vast, diverse country, I would differentiate, between a increasingly standardized but diffused state power versus an increasing economic, geographic, regional, cultural variation. And I think the standardized state power become much more rooted up and down the governance structure, largely because of the party's personnel system. And also has a lot to do with Xi Jinping's aggressive campaign to root out corruption up and down the system over the last few years. And this is often linked, with the rising trust, satisfaction of the people, especially with municipal, community level leadership. And a very consistent theme is that people have increasingly recognized the leaders have become less of talkers, but more doers. And that has a lot to do with what they've done with the environmental protection and other things. So I would say, even though the system has become very decentralized and decentered, but the personnel system remains largely intact and has been reformed and refined to produce a very different generations and crops and cohorts of leadership. And this gets back to the Shanghai comparison point that Xuefei brought up. This is often used as a counter case to the attribution of the rising large cases to urban density, right? So we know Shanghai is one of the most densely populated cities, not as much as central Mumbai, but it has the fewest cases and the smallest number of deaths among all the mega cities of the world. And also, it just happens to be the case that the central government moved the former mayor of Shanghai to be the party boss of Hubei province, right at the beginning of the pandemic eruption in January, late January, early February, right? So if you look at Shanghai's history, it has a very, I would say, professionalized, sophisticated local urban governance that dates back, maybe you could say, to its earlier exposure to Western colonial, semi-colonial influence, And a lot of the infrastructure, a lot of the governing ideas and practices, planning ideas, I think were partially imported, right? And so I would say Shanghai represents a bit of an exception, perhaps proving the rule. Now, on the doctor's variation, I would say that's a very interesting phenomenon. But I would say that has primarily rested on the individual, personal, medical, political, official positions of these doctors within the system. And, a lot to do with age. Zhong Nanshan, it's like almost like a founding father figure, right? Comes with age, seniority, and then there's expertise, and other things. And then I would say, Zhang Wenhong, again, a lot of it has to do with his own medical professional development, affiliated with Fudan, being in Shanghai, and so I think there's correlated attributes of how individuals present themselves and how much they can get away with how much they speak. And I would say, ultimately, I would say the difference between state power versus cultural collectivism, I would differentiate it by saying the political power structure is primary. The cultural collectives, norms, social networks is not only secondary, but serves a very different kind of role. I mean, if the state power is the driver, right? It's the skeleton, it's the the bones that around which the system is built. I would say the cultural norms and the peer pressures are either lubricants or glues that smooth out the system. And they certainly much more a following effect or supplementary complementary role as opposed to be the overarching, permeating, prevalent role, where that's where the state power lies. Even though that power has become increasingly diffused and rooted, but it still is resilient because the personnel system has been innovated in some ways and improved relative to the past.
Soumyadip, sir?
Okay.
Yes, yes.
Can
sir, if you suggest, I can ask a quick question to
Yes, please.
Yes, sir. It's so great that you brought up the question, also discussed about BRI. In China's governance, and I am also a China-India Visiting Scholars Fellow at Ashoka University, and also attached with Tongji and many places in China and all. So this thing has come up that there has been strong measures against corruption. Can you kindly tell us more about that what kind of good governance, and that also has the decentralized element into it. In India, we have also taken various measures like ease of doing business, ease of living index. We do many such surveys on cleanliness and intercities, and we also have smart cities program wherein we have made special purpose vehicle. So for example, New Delhi Smart Cities Corporation Limited or just Limited. So in China also I saw that all the cities have their own SPVs. But their mandate is more of like investment board. So they are also bringing investment. In Indian case, we are more of an executing body kind of thing, but not that active. So certainly the element which you just rightly suggested, and all of our experts here, be it Jagan sir, Subhagato sir, Tathagata sir, all have highlighted on this fact. Can you sir shed more light on what kind of, or what are the metrics of this kind of improvement in good governance or eliminating corruption, which sir you are stressing upon? Yes, Professor Chen.
All right. Well, thank you for that question. I mean, it's very layered, multifaceted. But I go back to a cumulative kind of outcome. If a steady continuing governing reforms that we highlighted in our paper. It has an iterative learning dimension to it. And it's increasingly also varied across cities. But when it comes to the pandemic response and control, I think there's relatively little variation in terms of how cities, mayors approach it. They all aggressive to the tilt, and they all wanted to control the very last case, right? So no exception, absolute approach. But with regard to innovation and other economic development strategies, you know, a global connectivity, a whole variety of things that we could now link to the uneven but increasingly coordinated implementation of the BRI. And again, we see a simultaneous convergence between a top-down advocated initiative and the sub-national level mobilization. Ziming's original point, you know, this goes back to the new book by Ming Ye, right, the political scientist, Boston University. And she coined this notion of mobilization state, right? When you look at the state, I think fundamental to our discussion, I can count 8 different adjectives that have been attached to the Chinese state, starting from authoritarian, developmental, entrepreneurial, infrastructural, mobilization, investor, and I have added a new one in my recent work, logistics. So the state to both the subnational level has become a very complex and self-adjusting political actor. Depending on the time and stage of development, different municipal, to the extent also provincial governments, would prioritize one particular role over the others when it comes to economic development, right? But collectively, they all have conformed and continue to follow a dominating developmental ideology. And that's why Wuhan suffered, because it invested most of the money into big mega projects at the expense of medical infrastructure, right? So that uneven emphasis from a local development point of view now has been corrected. I think that's Ziming's point, right? So now the new plan is to redistribute certain kinds of investment much more evenly. It used to be prioritized for only economic development or fixed assets investment. And now you see education, you know, public health and social welfare programs, you know, increasingly, obviously poverty alleviation is the big thing, but that has officially or nominally been achieved, you know, from a rural perspective. I think that's another very interesting comparative lesson or reference point for India in terms of rural development. We haven't talked much about the rural side of things, right? Now you're looking at the geographic spread of the virus. I think a lot of it's moved out of the big cities, and I think it is really ramping up or spreading in the rural areas. I mean, that's maybe, you know, Ziming's wildfire analogy. So it's very uneven, but I look at the map of India's cases. Again, I see a strong correlation between mega regions, mega cities, and the density and the higher number of deaths. But China was very fortunate. It had only one epicenter in Wuhan, and it was geographically confined because that one center accounted for 80% of China's infection and 70% of its death. Now within Hubei, Wuhan was again 70–80% of the cases. So China acted fast, but it also had only one place or one region to fight for. It confined that fight, and it did it very quickly. And the other large cities also implement lockdown, but they were proportional. It wasn't absolute. It wasn't, draconian. So I would say that's another, retroactively a advantage that China had. Instead of, dealing with a widely spread pandemic, it was able to suppress it when it only erupted, from that one locale. So I would say that's a big difference. And I think the only other minor recent border case in Rayleigh, one of my field research sites, the China-Myanmar economic corridor, I think, it's a small city, right? 200,000 people, a tiny little city, also by Indian standards. But again, you look at the implementation, the cross the board testing and tracing, it's exactly the same as large cities like Shenzhen, what Shenzhen is doing, because it wants to control the spread or the penetration from Hong Kong. So border control is a big thing. And again, I think India, Nepal, India, Myanmar, the long border, from India, Myanmar to China, I think is taken very, very seriously, not by just the local government, but all the way from the national government and through the provincial government and the prefecture government.
Thank you.
Thank you so much, Professor. Soumyadip sir, I'll just take one small question, since
yes.
the discussion is going so stimulating. I don't want to leave a point, sir. Especially when you mentioned Myanmar and the South Asia, and here the political system becomes so important. Then everything, as a scholar, we write, political will is the only answer, and like that. So what is your thought with this governance system? And at length we discussed about this personnel system and the reforms. How do you see the political system or the party system in China? And vis-a-vis other countries, does a party's mandate to have a good health or at the priority level vis-a-vis be it US or India or UK, Germany, other parts of the world? How do you see the party's commitment toward this issue? Is it leading to effective governance in China vis-a-vis other places?
Well, I would maybe turn back to Ziming, maybe speaking from the Wuhan perspective. Xue, maybe you have comparative perspectives to add here, so I don't want to monopolize, the conversation.
Sorry, could you just simplify your question?
Yes, Ziming?
Yes. Could you simplify your question?
Yes, I was saying that how do you see the role of the party, Chinese Communist parties, their commitment to this issue of health, public health, seriously taking at the fore of the governance vis-a-vis of the other countries, be it India, Myanmar, United States or others, because political will becomes one of the very important things for governance, be it any level, centralized or decentralized.
Yes, I think the resources that includes not only the direct health facilities and the labors, but also about the information and technologies, and also the expertise in this field. I think the centralized, the advantage of centralized governance for improving the public health system is we have a centralized idea, like how to make decisions, how to deal with the information of public health. This is the most important thing to make a centralized decision. And then the next step is the actions. Because of the centralized system and the actions in different stage and in different areas, they can coordinate together. For example, if in a crisis situation, then it's easier for the central government to dispatch the resources to different levels of different local levels. And if they have some achievement, and then the centralized system help them to collect the information. So which part the mitigations lack some resources or information, then the other parts could equalize the resources under the supervision of the central decision makers. So this way, the efficiency and effectiveness could reach out. This is my understanding. And for the democratic system, maybe not democratic, I think it's decentralized. That decentralized system have some cases in China too. But for example, in some small areas, in some small cities before the crisis, and they have some local health problems. Sometimes they can deal with it at local level, and then they don't need to report the situation directly to the central government. So we still have some flexibility here. So if we can learn from the flexibility and then to apply it to different regimes, different society, then we can make the license in China more well accepted. But I know that this is a case of the small areas that they can control their problems. It's a very hard to find the case, and then we need to do more studies and then maybe waiting for some new phenomenon happened, then synthesize that into a bigger theoretical framework and to see what is the flexibility or resilience of the centralization, and what is the balance between the centralization and decentralization. So my understanding about centralization is like, if there's no decentralized way to make a local level to adjust it to the change in the top level, then it's very hard to draw the lines between the centralization and decentralization. It's a kind of abstract, but still we need to use the case to explain it clearly. But yeah, I think that's it. Right now, I just think about this, but in the future, I will do more work on it.
Well, thank you.
Thank you,
Ziming. Yeah, thank you, Ziming. And just to add to this discussion, while we are discussing the Indian cities' responses or Indian cities' ability to responses to this pandemic situation, I think one important aspect we need to also think about the socioeconomic inequalities in access to urban basic services within in India. That means how the cities are built, because well, if you just consider this public the preventive measures like frequent hand washing with soap, well, this is very much appropriate from a public health perspective, but that actually belies the realities of water access in India, because even if you just look at the official Indian statistics, then a significant proportion of urban people, especially those who are living in the slums and in the informal settlements, they do not have access to adequate and adequate amount of water. So definitely this government or the preventive measures of washing hands regularly must be considered within these sets of pre-existing context, which actually influence also the Indian cities' ability to respond to this pandemic. This is specifically relevant for the Indian cities because at the end of the day, we talked about or rather, a lot of emphasis has been put on this collective action. Okay, and even if we look at the preventive measures which are prescribed by the World Health Organization and subsequently followed by the Indian government as well, then we see that so these are actually call for some sort of behavioral change among the people, but that does not just does not happen, because behavioral changes efforts that are no substitute for reliable and affordable water supply to all. So that's also need to be taken into account while discussing the pandemic responses, especially the ability of the Indian cities to respond to the pandemic situation in India. So now let me again just I request all our discussions to say take a minute or so to share their comments on the responses by Professor Zain and Dr. Li. And let me start with Professor Jagan Shah. I request.
Jagan sir is not here.
Okay, then Professor Dr. Subhagata Rajgupta.
Thank you so much. No, it was, thank you very much. We would, I would like to request IMPRI to maybe organize a second follow-up talk on the topic. It was very helpful, and I think the more we get to discuss China and India, it'll make a lot, it'll gain, it will help our researchers and communities to better understand, the global context, because we do hear more of the West than we need to, we need to hear more about the East too. Thank you very much. I really enjoyed it and hope to be in touch. Thank you very much.
Thank you, Dr. Dashgupta. And now I request Professor Zufei Rain to.
Hi. Yes, I don't have much to add. I've been listening very attentively and also taking notes. I've learned a lot from both the speakers and also the panelists. I think China has been a very important reference point for understanding pandemic governance, but I just want to point out that maybe the Chinese story is not that unique. So from a comparative perspective, we see, so for a lot of the examples Ziming gave in her presentation from Wuhan, we can find similar examples in other cities or places around the world, including not touching the button in elevators. So in the city where I live, Chicago, people use their car keys to press the button. And not all, but a lot of the public sculptures, it doesn't matter if it's a human or a dog or a cow. So a lot of them have masks on. So those are just some random examples. But my point is there's a lot of convergence in how different communities have been responding to the pandemic. So China is unique, but in many aspects, it's not an outlier. So in that regard, regime types, democracy or non-democracy, is just one of the factors for understanding the differences. It's not a small factor, but there are so many other things going on. So we should have a more holistic perspective instead of only focusing on political regimes. Thank you.
Thank you, Professor Rain. And just let me now move to Professor Untitled Chattopadhyay. If you are here, sir.
Yes.
Yes, so if you could please share your comments within a minute or so.
So don't have much to add. I'd like to add only one point that, there is a lot of difference in the overall political structure in governance between India and China. But I think the main lesson that we can draw, and maybe which can be a good pivot for comparison, could be more at the level of the local government about the functioning, the power, the organizational structure, and the responsibilities bestowed at the level of the local governments and how they interact with the local communities. I think, that's a very good area where we can draw upon quite a lot. More at the level of urban management rather than in the area of governance. In the governance area, there is a lot of differences, but more in the operational area of urban management, I think, there a lot more can be learned.
So, so thank you, Professor Chatterjee. And so am I audible? Actually, just
Yes.
okay.
Yes.
Okay, thank you. So now let me just go back to Professor Chen for his final remarks. So if you want to add anything on today's discussion, your final.
You mean me again? So
yes.
Yeah. Okay.
Yes, please.
All right.
If you
Well,
just
I just
in a
wanted
minute or so, if you want
to
to say. Yeah.
Provide one last piece of evidence to Ziming's point about active and proactive in response to current or future public health or whatever other crises. Recently, getting back to my point about the importance of borders, the Chinese government has sent medical teams to the country of Laos, across the border through Yunnan province, to help train and local medical personnel about issues related to hygiene and other preventive measures, and together also, with PPE, supplies. So I think that, what we have seen here is that China has not only, I guess, become a one model or one approach of sort, but also began to extend what it believes to be a very strong, effective strategy to other countries. And you could look at the amount of vaccines that China has sent out, 200 some plus millions. A largest share of that is for the BRI countries, right? The 65 countries along the Belt and Road. And again, it's related to my point about, what's going to happen from now on, what role China is going to play. I think we should watch that space very carefully, very closely, because it's going to matter a lot, especially that China seems to be so far ahead of other countries in extending the public health medical expertise to the global south. And I think the impact is going to be more significant and less political than probably a lot of people assume it to be. I think it's going to be a lot of practical influence at the ground level and the level of cities and the communities. Not just the water supply, but I would add to your point about electricity supply, sanitation, right? Now if you have cities like India or Pakistan, Africa, that cannot supply electricity on a regular, sustainable basis, how do you deal with the storage of vaccines, or other medical supplies that will require, that piece of basic infrastructure? So I would say infrastructure export, infrastructure standardization, the bundling of infrastructure extension from China to the global south, it's a hugely important and timely research question.
Thank you, Professor Chen. Yeah, really, we need to have much more collaborative work to better understand the local conditions, the exact vulnerabilities, and the capacities of all the city governments, so as to better allocate the resources and also to build up the cities which somehow conform to the goal which are actually placed among the SDGs goal to respond to the call of leave no one behind, or even if you look at the new urban agenda, which is propounded by the UNDP of leave no place behind. So only when only after ensuring this basic motto of SDGs or the new urban agenda, we can better prepare our cities, we can better future-proof our cities, we can increase the resilience of our cities. So with this, let me now again request Dr. Arjun Kumar, who is the director of IMPRI, to give the vote of thanks. It's over to you, Dr. Kumar. So Arjun, are you here?
Sir, I'm here, yes.
Yeah, please.
Yes. Thank you everyone. And yes, so Thank you. Such a stimulating conversation. And let me just rewind and go back to Subhagato sir, as he suggested that we should stick to this topic. And Professor Chen very kindly suggested that we stick to this topic also. We were also discussing about BRIs and everything. And as Subhagato sir also highlighted, and Soumyadip sir also said that the access to basic amenities and the supply side remains such an important point. So be it BRI, in India, we have now National Infrastructure Pipeline. It has more than, now it is touching more than $2 trillion of investment in terms of investment, which contains all the projects. We have Sagarmala, National Highway Program, Uday for electricity connection, Amrut program, so many of that. So that remains very crucial also in terms of greening and other things. So as Subhagato sir suggested, we will really try to do a panel of this and come back with the infrastructure story. I will take time from all of you, Zufai ma'am also, Jagan sir also, Tathagata sir, and Ziming of course, to look into this dimension and the things Professor Chen is also trying to highlight with us so kindly. So looking forward to that session as well. And I must say I'm very excited and elated because this remains also close to my working area. With Subhagato sir, I've been working with a decade in sanitation and all kind of supply side. And sir now leads South Asia in septic management and all those kind of things, very advanced level of things we have tried to focus and work upon. And it would be a delight to learn more in that. So once again, let me thank all of you, those who are watching here and would be watching it afterwards on YouTube, Facebook Live, and our other Google podcast portals and all. So on behalf of Center for Habitat, Urban and Regional Studies at IMPRI, Impact and Policy Research Institute, New Delhi, we thank all of you for being here with us for our series, The State of Cities, #City Conversations with Dr. Soumyadip Chattopadhyay. On today's deliberation, A People's War Against COVID-19, Unmasking the Governing Power in China, by our speakers. And also they have a lot of literary works, report books and articles and so on by Professor Xiangming Chen and Dr. Ziming Li. Thank you, Professor Chen, for joining from the United States and Ziming from China, Wuhan. And I would also like to thank all of our distinguished panelists also today here, Professor Jagan sir, Dr. Subhagato Dasgupta sir, Professor Zufair, and thank you, ma'am. I wanted to hear so much from you. Maybe I'll give you a call and learn more and discuss more on things. Professor Tathagata Chatterjee, sir, thank you so much for being a very academic support. Your support means a lot to taking this kind of deliberation much forward. And thank you so much, our moderator for the series, Dr. Soumyadip Chattopadhyay, for being so active and getting our traction back to these very important issues. So with that, please take care of yourself and all of you. And we wish good health to all of you. Thank you. Professor Chen, would you like to say?
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, President. Have a good night.
Thank you again for hosting.
Yeah.
Thank you. We'll
Thank
be
you,
in touch.
Ziming.
Thank you.
Thank you. Bye-bye.
Ziming,
Take care.
congratulations. Thank you.
Thank you.
Thank you. Must be late for you. Please sleep well. Thank
Yep,
you.
really enjoyed it. Thank you.
Take
Thank
care.
you all.
Yes.